Hi, I'm Bernadette Wagner, and I'd like to welcome you to Healing, Hope, and Health, the program that educates the public about the medical, social, emotional, and spiritual care provided by Hospice of Washington County to seriously ill patients and their family members. It is my pleasure to introduce Marcia Hickey, the Manager of Care Management at Meritus Medical Center, and Jamie Hess, Nurse Consultant for Hospice of Washington County. These two incredibly compassionate professionals are dedicated to ensuring the highest quality of care for their patients. Marcia and Jamie join us today to talk about their respective roles and how they collaborate in order to arrange uninterrupted, high-quality care for patients being discharged from the hospital. Welcome, Marcia. Welcome, Jamie. Thanks for being here.
Thank you.
So, Marcia, maybe we can start off with you. What is the role of a care management team at Meritus?
Our team is comprised of nurses and social workers and support staff, and our main focus is helping patients through the progression of their care in the hospital, helping them link to the community. We're working on identifying what are the disease management issues that they have, what are the social issues that they have, and helping them with their families to help understand their disease processes.
So part of what you do is also education for the families?
Yes, it is. And
okay.
we really focus on linking our patients in the community, so when they leave us, they have all of the support systems in place that they need to continue to get better or to manage the disease that they have.
Okay. And as the care manager of that team, how do you support them and how do you work in tandem with Hospice of Washington County?
Well, as the manager and with hospice, they're a very pivotal part of our team.
Okay.
We have a liaison on site for us, and we recognize the importance of patients who are dealing with a terminal illness or an end-of-life disease process, and they need that support with hospice. And many times they may not be in the place where they're ready, where treatment isn't effective anymore, but they know that that time is coming in the future. And hospice, we can even, we like to talk to the families and have them have hospice come in for just an instructional opportunity so that when they're ready, they know they can call them and they can plan their disease and they have control of when that's going to happen, how they want to live their life from now until that does happen.
Okay.
And it just makes them have much more dignity with the phase of dying when it comes. It's a great support for them, and it helps the families emotionally. They have great grievance programs at hospice to deal with the time when their loved one does leave.
Okay. And Jamie, maybe you can tell us a little bit about your counterpart experience and your role at Meritus.
Okay. I actually am a nurse consultant, and I work directly with Diane, who's the nurse liaison at Meritus. And together we find patients that may need our services or may need some education on hospice care and what we can provide to them either in the hospital or in the community after discharge.
So I imagine when you talk with the patients and the family, just knowing that getting some information might, and giving them a sense of control would help to reduce maybe some of the fear and anxiety that they feel.
Absolutely.
Yeah, okay. And Marcia, what is the process that a patient or a family member would go through to refer somebody to the nurse liaison or to Jamie as the nurse consultant?
Okay. There's multiple avenues for us to make that referral. Sometimes the physician themselves will write the order. They've had that discussion with the patient and said, you know, it's really time. And they will place a physician order in the chart. But also we do an assessment on every one of our patients, and we have a risk scoring where we look at how do we identify what their needs are. And when we see that they're in the end stages of a terminal illness or their disease is progressing where they may want to have that conversation, we ask the patient and then we talk to the physician and we make a referral. The liaison rounds every day and we let her know which patients we feel would really benefit from a hospice consultation or referral. If it's a true consultation, it does have to have the physician also be feeling that the patient's ready and this is the place they need to be. But if they have this disease and they want the instructional visit, we can talk to the family about that. And we really encourage that because having that time to prepare for the end of life just helps you move through that so much smoother.
Right. And Jamie, once you receive a referral, what is the process that your team goes through?
What we do first is we meet with either the patient or the family to discuss our services, go over everything, answer any questions. Then Diane and I also go in to see if the patient is medically eligible for hospice, do an evaluation. And what our plan is to have everything in line once they discharge, so there isn't a lapse in care. Have the equipment set up in the home, and the team ready to support them once they discharge.
And when you say medically eligible, do you mean that they are in a position to receive hospice care because they're
because of their
deemed
illness.
as to have 6 months or less of life? Is that
Correct.
okay? So a life expectancy of 6 months or less.
Correct.
And then you work with their families to bring in the medical equipment and arrange for the nurses to come to the home?
Correct.
That's great. That's great. Well, maybe just real briefly, you could tell me a little bit about, from your perspective, how the patient and family members benefit from having hospice at Meritus.
Well, I think that having them on site and having that linkage is just so important for, at the time they're in the hospital, it's easier access for them, so that we can identify what their needs are, bring the family together. Sometimes we have family meetings and we have hospice come and they talk to them along with the physicians at the table and just help them, bring them to a place where they can identify what their needs are and what they want, and then set up that plan.
Did you have anything you wanted to add, Jamie?
No, that's exactly what I was going to say. We do that, as well as sometimes we have patients in the hospital that we actually see, and we can provide one-on-one care to manage their symptoms.
Well, thank you both so much for being here. I'd like to thank Marcia and Jamie for taking time from their busy schedules to join us today on Healing Hope and Health, and for the wonderful work they do every day. Caring for the terminally ill can be demanding, but I can also see that it is extremely rewarding. According to Elizabeth Kubler-Ross, she said, "Those who learn to know death rather than to fear and fight it become our teachers about life." Marcia and Jamie are wonderful teachers, and I'm grateful for what I've learned today. I'm also grateful to you for tuning into today's program, and hope you'll stay with us while we take this short commercial break. We'll be right back after these messages.
I'm the hometown favorite.
I'll outsmart you.
I will beat you.
I'll be surrounded by fans cheering me on.
There's no place like home for fighting cancer.
My turf.
My time.
My team.
Expert care, close to home. The John R. Marsh Cancer Center at Meritus Health.
Arbors Carson Jewelers has been your community jeweler for over 110 years. We have the region's largest selection of diamonds, designer jewelry, including bridal, gold, and silver fashion jewelry, and fine Swiss timepieces. We strive to combine quality, expert personal attention, and affordable financing to create an exceptional shopping experience aimed at exceeding your expectations. At Carson's Jewelers, there's something for everyone that will bring a smile to that someone special in your life.
Hi, I am Dr. Olenzak at the Pain and Spine Institute. I specialize in the most advanced procedures and technology available in pain management. At your visits and procedures, you will always see me for continuity of care. I would like to thank all of my patients for allowing me to provide you with the specialized care that you need. To give you this level of care requires a team. This is your team at the Pain and Spine Institute. To become a patient, call 301-739-7900 or go to painfree-md.com.
It is my pleasure to again welcome my friend and colleague, Maggie Terry, to today's program. Maggie is a licensed clinical social worker that has been with Hospice Washington County for 7 years. Maggie is currently teaching a Cooking for One class at the recently opened Boonesboro Life Center. She joins us today to tell us all about it. Hi Maggie, thanks for being here.
Oh, thank you so much.
So I'm excited about the Cooking for One seminar. Can you tell us a little bit about the purpose and the format of this program?
Yes, my idea was to reach out to people who are struggling with that one task, and that's fixing a meal for themselves. They may in the past have cooked for somebody, had a family, and now it's a big adjustment. So that was really my target audience.
Okay. And so is the idea that you're not only giving them recipes, but that you're also coaching them into through their grief so that they can care for themselves?
Not all of people who come might be grieving, but I think they all struggle with, oh, why should I bother cooking just for myself? Right. That's often a big question.
And what do you say to them?
And so I say, you know, really, you are worth it, and it can be fun, it can be easy to put together fresh ingredients, things that are nutritious, and make it for yourself. So I try to help them with that.
That's great. Can you tell us a little bit about some of your cookbook, some of the tips, and also maybe some of the recipes that you've included?
Yes, when I was putting the program together, I thought it'd be great to have a little cookbook with all the information in there. So I have shopping tips, I have recipes that you can easily do for one person, like wraps and smoothies. And since the seminar, I'm going to add some more in there in the cookbook.
That's great. And now that seminar was in mid-April, but you have another one coming up on May 21st.
I do. May 21st, I'm holding it 2 times, one at 2 o'clock and one at 5:30.
And that is to give people an opportunity, if they couldn't make in the afternoon, they might be able to be there in the evening. That's great. I appreciate that. What are some of the other support groups that are being held in the Boonesboro Center?
We'll be starting a loss of child support group at Boonesboro, and this will be open to anyone who's lost a child. And the idea is really to be centered there in Boonesboro. There have been several families that have lost children recently, so I'm reaching out to them, and they will be helping to lead the group. I'm really going to give them some of those responsibilities. I'll be more of a mentor and facilitator.
So this idea actually arose from the community coming and saying that this is what they needed?
Yes, I did. I had a parent come to me who was looking for something like this and wanted to start a support group. And we have the facility, and I'm absolutely happy to help with that.
That's terrific. Yeah. If someone is interested in joining that support group, or maybe another support group, or contacting you for individual counseling, how do they go about that?
They can reach me at the Boonesboro Life Center. The number's 301-671-6927, and we're open Monday through Friday, 8 to 4:30.
Terrific, terrific. Is there a charge for any of these seminars that you teach?
No, everything held at the Boonesboro Life Center is free of charge. It's really part of our mission to reach out to the community and build community ties.
Great. Maggie, speaking of the community in Boonesboro, can you tell me a little bit, just from your perspective, what the mission of the Community Life Center is, and how it's there to serve the community?
Really, our mission is to build relationships between our agency and the community. At the same time, we would like community members to build relationships between each other. So we encourage community members to use our Life Center to hold their own seminars and talks. And maybe they can teach someone in their community a new skill, have some fun, maybe make some new friends.
That's really terrific. I love that. Does that address loneliness? Is that would that help those who are grieving in particular?
I think there are many people all around us who are quite lonely and not sure what to do and how to get out of that. And we want to foster more connections so people are not feeling so isolated.
Okay. So loneliness is one of the things that people experience when they're living by themselves. Are there other challenges in particular that you would?
I would say what I hear most often, especially someone who's lost a loved one, is getting through those evening hours by themselves. It may have been a time where they would talk with their loved one to talk about events of the day or the news, or share that evening meal, and this is a tough time for them. So I talk to them about adding activities to their day that they can do just in the evening, and that'll help them get through it, to keep busy.
Well, thank you, Maggie, for joining us today.
Oh, you're quite welcome.
I'd like to thank Maggie for being here today and for sharing her knowledge and talents with those who have and will attend her cooking seminar. Maggie's words of encouragement to get involved at the Community Life Centers reminds me of Mary Ann Radmacher, author of Lean Forward Into Your Life, who said, "As we work to create light for others, we naturally light our own way." May we all, professionals and volunteers, young and old, join together to light the way for our community. We'll be right back after these messages.
People don't realize it takes a lot to care for a family member in your home. John's dad was very headstrong, so I think that was a lot for him to get over and try to come to terms with that he had terminal illness. I would recommend to everybody to get hospice involved at the get-go. When you first learn about it, get it set up. It's going to make it, I mean, it's terrible what you're going through already, but it's going to make it easier for you in the long run because we couldn't have done it without them.
Call Hospice today. Hospice of Washington County, when time matters most.
From the smallest item of jewelry to the largest ceramic elephant, every 10,000 Villages handcrafted product makes a remarkable journey.
All over the world, our products travel similar paths, over thousands of miles and years of artistic tradition. Our handcrafted gifts represent work that builds villages and sustains souls. They are the dream of a better life made real. Every product is a miracle.
Welcome back. It's my pleasure to introduce our next two guests to Healing Hope and Health. First, I'd like to welcome Pete McMillan. He is a hospice care consultant who tirelessly works to meet the needs of those with life-limiting illness. In addition, he works closely with Washington County Cares, Inc., an organization committed to supporting caregivers. He joins us today to talk about the upcoming Senior Expo. I'd also like to welcome Brandy Beard. Brandy is the proud mother of two wonderful children, a passionate advocate for those suffering from dementia, and a full-time activities director at the Kaufman Nursing Home and Rehab Facility. Brandy will be at the Senior Expo doing what she likes to do best, educating participants about dementia. Today, Brandy will tell us about a special tool she uses to help caregivers move from simple sympathy to compassionate empathy to real understanding for those with dementia. Welcome, Brandy. Welcome, Pete. Thanks for being here.
Great. Thanks for having us.
Sure. Pete, let's start with you. Maybe you can tell us a little bit about the Senior Expo, when it is, and why we're holding this event, what the purpose is.
Sure. Washington County Cares Senior or Caregiver and Senior Expo and Dinner is really a great event that we've done over the last few years. We hold it there at Hager Hall, and it's an opportunity for folks to learn about different resources that are in the community.
Okay.
We'll have over 40 different resource providers from the area, everyone from people that can help you to buy a car, people talking about senior health care and safety, assisted living providers, rehab providers, just a broad range of services, even things you never even thought you would need. They're there and they're giving information about some ways that they can help.
Okay, so it's at Hager Hall, and what's the date?
The date's May the 14th. That's a Thursday.
Okay.
We'll start with bingo, which is always one of the highlights of the day. We'll start with that at 1 o'clock.
Okay.
And then at 2 o'clock, the main part of the expo will begin, and all the folks will be there with the information. And that will run till about 4 o'clock. Then at 5:30, we'll start the dinner. And at the dinner, we're going to be having some live music from the Barbara Ingram School for the Arts. We're also going to be having a speaker, Mary Fridley, talking about how to relieve caregiver stress and helping folks, whether they're a professional caregiver, whether they're a caregiver for a family member, they really will learn a lot from the information that she has.
That sounds so interesting. Is there a cost to this event?
For the main part of the expo and for the bingo, there's absolutely no cost. Now for the dinner, the tickets are $20.
Okay.
And that goes to help cover the cost of the dinner and also provide some funding for our respite care program, where we help to provide extra care for the caregivers.
Terrific. Brandy, I know you'll be at the Senior Expo and are going to be bringing this special tool. You want to talk a little bit about?
Virtual Dementia Tour.
Okay.
To sum it up, Virtual Dementia Tour is a program that's licensed by Second Wind Dreams. You can see all about it on their website. But we purchased the Virtual Dementia Tour as a way to train our staff. We have a large population of our residents with some sort of stage of dementia. And in my research of trying to find the right tool to train our staff, to educate them in the most ways possible on know how to work with the residents one-on-one, found the Virtual Dementia Tour to be the basic thing to use. It gives them such an idea of how to respond to that patient in many ways.
And so basically what this tool does is it simulates dementia by altering the senses, the vision and the hearing.
It does. You actually become the patient. You become the resident. And you learn, you get your senses taken away from you. You're given multiple tasks to complete during this virtual tour, and you're timed. And what happens is when you go to complete those tasks you're just unabled. I mean, you're not able to do those. You feel that sense of, or the lack of being able to complete very simple tasks that we take for granted daily.
So when people go through this tour, do they sometimes experience the frustration that somebody with, or fear that dementia patients might experience?
Yes, they do. They absolutely do. We've had people even stop and say, I'm done. I'm not going to complete.
Okay. And is this something that at some time, even at the expo, that family members might try the equipment and have this experience themselves?
Yes, we will be there. We will be set up if anybody's willing, able, and would just like to try it out. It's for caregivers, even any nursing home staffs, rehabilitation staffs. It's good for everybody to get that sense and the window into their world.
Yeah, I think I like that window into the world.
I know,
or
I
the
love
sense
that.
of walking in their shoes to really understand.
That caught me. That actually on their Second Wind Dreams website, when they talked about the Virtual Dementia Tour, they summed it up by saying, take the window into their world.
Well, and I understand that Kaufman has a large rehab program too they're doing now.
They do. We are a skilled facility. We have a good many rehab patients as it is. We have a lot of rehab beds that we're able to fill. We have nursing home residents as well. So if there is ever a time that you need that, that's available as well. But if you start out in rehab, we're very, very known for that.
Well, thank you so much both for being here.
Thanks for having us.
I'd like to thank Pete and Brandy for making time to be on our program and for all they do every day to support caregivers of the seriously ill. Sometimes being the primary caregiver can be overwhelming and exhausting. If you find yourself in that situation, remember Hospice of Washington County and many other agencies are there to support you. I encourage you to attend the Senior Expo, check out the Virtual Dementia Tour, and learn about other available resources. Remember, you don't have to go it alone. We'll be right back after these messages.
Arbors Carson Jewelers has been your community jeweler for over 110 years. We have the region's largest selection of diamonds, designer jewelry, including bridal, gold, and silver fashion jewelry, and fine Swiss timepieces. We strive to combine quality, expert personal attention, and affordable financing to create an exceptional shopping experience aimed at exceeding your expectations. At Carson's Jewelers, there's something for everyone that will bring a smile to that someone special in your life.
I'm the hometown favorite.
I'll outsmart you.
I will beat you.
I'll be surrounded by fans cheering me on.
There's no place like home for fighting cancer.
My turf.
My time.
My team.
Expert care, close to home. The John R. Marsh Cancer Center at Meritus Health.
People don't realize it takes a lot to care for a family member in your home. John's dad was very headstrong, so I think that was a lot for him to get over and try to come to terms with that he had terminal illness. I would recommend to everybody to get hospice involved at the get-go. When you first learn about it, get it set up. It's going to make it, I mean, it's terrible what you're going through already, but it's going to make it easier for you in the long run because we couldn't have done it without them.
Call Hospice today. Hospice of Washington County, when time matters most.
Welcome back. It's my privilege to introduce our next two guests, James McGee and Eric Sarmiento, owners of Regenerate, Flotation Therapy Center, located in the Grand Building at 20 West Washington Street. Flotation therapy, according to their website, has many benefits, but chief among them is the reduction of stress and anxiety, increased mental clarity, and increased sense of well-being. When they learned community volunteers could lead programs at the Hagerstown Community Life Center, they offered to teach a class that offers similar benefits. James, a life seeker, martial arts teacher, and lifelong practitioner of meditation, teaches mindful meditation every Monday at 3 p.m. at the Hagerstown Community Life Center. They join me today to share their motivation for getting involved in the Life Center and to tell us how meditation and flotation work together to enhance one's quality of life. Welcome, James. Welcome, Eric.
Thank you.
Thank you.
Thanks for being here. First of all, tell us just a little bit about your business, when you got started, and when your hours are.
We got started about 3 months ago. We opened the doors to the community, and basically floating is our chance to give back. As a business, when we decided that floating was something that we knew could benefit the community, we said, hey, let's make sure that, number one, we find something that can be beneficial to everyone, and really market it the best way possible. So through hospice, which you guys are in the same building as us, was really neat. We kind of found a common bond where, you know, we can use floating to help, you know, vets, people that are pregnant, that are suffering from pain, stress relief, things like that. In conjunction with what you all were doing, it's like a perfect fit. So
that's great.
Yeah.
And what are your hours of operation?
Yeah, we're open 7 days a week, and Monday through Friday we open our doors at 10:30 a.m. and we close at 9. The weekends even earlier at 10, and then same close at 9. So
perfect.
Yeah.
Okay, and James, maybe you can tell us a little bit about your meditation experience and why you decided to offer the mindful meditation class for at our Life Center.
Well, you know, I've always gotten a joy of helping other people, and I've kind of done it much through, you know, my teachings as a martial artist and seeing the development of the children. And, you know, this was an opportunity to kind of pass on something that I've been kind of practicing myself, and teaching, you know, people and passing along my knowledge and experience from managing distractions, which are, you know, always, you know, around us, that, you know, and learning how to deal with those.
And in the meditation class, is this something that's accessible to everybody? Do they have to be able to sit in a yogi posture, or what's your take on that?
Yeah, and one of the things I want to convey to people is, you know, meditation isn't a specific, you know, style way that has to be done. It's really, you know, I want it to get out there that, you know, anyone can do it, and you don't have to be in a specific position or in an environment. In a sense, it's just available to us very much, you know, anywhere. Just sitting, as long as you're comfortable, is really the main thing I want people to understand.
And then that once you're sitting, you're learning to close out the distractions or shut them off?
Not so much shutting off. It's not about tuning out. Meditation is, and I want to, you know, is to let people know that it's not about tuning out. It's actually about tuning in, and really tuning into yourself and having a better feel for who we are, and which in a sense allows us to understand other people better as well.
Great. And Eric, maybe you can tell us, how are meditation and flotation similar? I mean, how do they, where's the connection between the two?
Well, managing distraction is key in letting go, and floating lends well to that. While you're floating, there is no distraction. It's really funny you asked that, because I learned how to meditate through floating. So I'm one that, you know, there's a lot going through my mind, as many others I'm sure can kind of understand. So I actually floated, and everything was removed, no distraction, and so that allowed me to let go and kind of find a deeper state of mind. So that's where the tie-in is.
That's great. Well, thank you so much for both being here. I wanted to remind our viewers that if they want to sign up for the meditation class, call Hospice, and if they'd like to sign up for flotation, to call Regenerate.
Wonderful.
I'd like to thank James and Eric for being with us today, and thanks James for teaching mindful meditation at the Hagerstown Community Life Center. If you would like more information about mindful meditation or Regenerate therapy, visit Regenerate website at feelregenerated.com, or visit Hospice of Washington County's website at hospiceofwc.org. I'm taking the meditation class, and I hope you'll join me. It's been a great experience. You'll be glad you did. See you next time.